Hey everybody, Dr. Patel here. Thank you for joining me on our Facebook Live this week. First and foremost, this is a special week because we're saying happy belated birthday to the Marines and a happy belated Veterans Day to all of you who have laid down your lives and your bodies and your souls and your energy for protecting our country. So thank you so much for your service to all of you veterans out there, but also to all the active duty military and really all of you have been doing a tremendous job protecting our country. And unfortunately, a lot of you have developed musculoskeletal conditions and pain conditions as a result of the sacrifices that you've made for the U.S. So that really is why we wanted to discuss this topic that's really near and dear to a lot of folks' hearts, which is the concept of chronic pain. And chronic pain is actually not something that I treat regularly at my clinic. So when we think about what chronic pain actually is, it is a long-term condition that really is multifactorial. In my clinic, in my office, we treat specifically injuries and degenerative conditions that can have chronic pain associated with it. But by and large, we're treating specific musculoskeletal injuries or degenerative conditions. We're not necessarily treating the chronic pain. So I know that sounds a little bit confusing, but there's a really strong distinction that needs to be made oftentimes because the management of chronic pain has a lot of parallel, a lot of symmetry, a lot of overlap with the management of specific injuries. But chronic pain itself needs to be managed in a little bit of a different way. And now I oftentimes discuss the management of chronic pain as a part of the overall treatment strategies that we use in our office. But really the point of today is to help define what chronic pain is, and to explain the different factors or different facets that are associated with chronic pain. And also to describe some of the different treatment strategies that are available that could be really beneficial for chronic pain conditions. So first and foremost, what is pain? So, a lot of folks think of pain and think of, the concept of what's called nociceptive pain, which is pain that's associated with an injury or a trauma, something that causes damage or harm that ultimately causes pain to occur. So there's the nociceptive pain that has to happen because of some level of tissue damage. And then there's this chronic pain that continues or persists thereafter. And there is a big, strong difference between those two. Now, when we talk about pain in general, pain is really a perception. It's a feeling. It's actually something that our brain is perceiving based off of what's going on or not going on in our bodies. So there's different factors that are involved with pain. Pain, it really is a personal experience because people deal with pain in different ways. There are some folks that are more sensitive to pain, or there are some people that are more tolerant to pain. There's some people that actually don't feel pain. I have one patient that actually has a genetic condition that prevents her from feeling any pain. And I mean, it sounds fantastic for those of you that are suffering with various different pain conditions. I mean, that could sound like it's fantastic, right? But pain is actually not necessarily always a bad thing. pain is actually a good thing in certain respects because it tells us when we have an injury. It tells us when we have something negative that our body is experiencing. So this patient of mine that has no sensation of pain, she's actually had multiple injuries because she's had traumas, had skiing, snowboarding, various different injuries where she didn't recognize that her body was sending the signal for pain, and therefore she ended up having worse injuries like broken bones and tendons and all of those kind of things. So, pain, as much as it is an uncomfortable thing and oftentimes a debilitating thing, in actuality, the purpose of pain is that it is meant to be a warning sign. It is meant to allow us to understand when we are putting ourselves in harm's way. So pain is a very personal experience, but pain has, genetic factors, as I've mentioned. Some people are genetically more predisposed to actually perceive pain, and whereas others are genetically not, as I mentioned. But pain and nociception are ultimately different things. So what do I mean by that? The concept of nociception is that, as I mentioned earlier, nociception is when you actually step on a thumbtack or thumbnail, whatever. If you step on something sharp, and you suddenly feel pain, that's your pain receptors, those little receptors in your skin, feeling the trauma that occurs and sending the signal all the way through the nervous system to the brain to say, hey, I just stepped on something sharp. So nociception is the perception of trauma, versus pain is the feeling that we have that's associated with that. And like I said, different people feel these things in different ways. Some people can step on something sharp and be like, okay, that was something sharp. Versus some people step on something sharp and scream bloody murder, right? So that perception is where the concept of pain actually comes into play. And then pain itself has various different explanations or various different feelings that are associated with them. So some can feel burning, some can feel raw or deep or achy pain, sharp pain, dull pain, pressure. All of these various different things can influence the way that we feel and even describe what pain is. The concept of pain could be different for different people. So that being said, pain comes in a lot of different forms, and to break it down, I'm kind of going to go over this concept of pain and nociception. You know what? I'll break it down a little bit from here, and we'll actually call it a few different types of pain, right? When we have pain here, we have nociception. Hold on, let me just circle this guy and get this guy out of here. We have nociception, which is one type of pain. And then we have what's called neuropathic pain. Neuropathic. Which actually involves signaling to the nerves, right? If there's irritation or damage to the nervous system, the nerves are the electrical wiring that carries signals to and from our body. So when we have pain somewhere, like our foot, we stepped on a thumbnail, that signal of pain is carried by the nervous system. But what happens if the nervous system itself is irritated or becomes damaged? Well, then that's when we develop what's called neuropathic pain. And there's different varieties of neuropathic pain, including when we have something like a pinched nerve in the low back and we feel stuff going down our legs, like sciatica. Well, that's a nervy pain or nerve-related pain where we're not necessarily feeling a trauma that has occurred in the foot or the leg, but that's where we feel the pain. The trauma is actually coming from the nerves themselves. And then there's other types of pain as well, and these type of pains end up becoming more of not necessarily a trauma to the foot, not necessarily a trauma to the nerves that are causing symptoms to be felt in the foot, but an irritation of the system. So the whole nervous system, if that gets shocked, if that gets rewired, if that gets kind of irritated in one way, shape, or form, we can end up feeling pain in an area even though there's no specific irritation or damage to the nervous system and no specific damage or irritation to our arms or our legs or our body, but this signal of pain continues to persist, and that falls into this category over here. Now these things, as I've kind of mentioned in these Venn diagrams, are oftentimes interrelated, and sometimes it's that nociceptive pain that causes us to have the nervous system pain. I'm going to call that nervous system pain, NS. This is something that could all come together, and if we have a combination of these things going on, well, that combination of things is really where symptoms could be really, really debilitating. But ultimately, these are different types of or categories of pain that can occur, and different varieties of things that can develop into chronic pain. So what's chronic pain? So chronic pain is ultimately if any of these systems is going on and going on for a long time. So there's different definitions of chronic pain, but people say that if pain is persisting for more than 3 months, as little as 3 months, then that could be considered chronic pain for all intents and purposes. But when we think about it, it's pain that is persisting for a long time. So when we have chronic pain occurring, then basically we start to develop different components to the pain. So what do I mean by that? So when you have chronic pain occurring, right? You may have had some nociceptive pain or neurogenic pain that started this in one way, shape, or form. But now chronic pain has become its own animal. It's become its own beast, so to speak. Because what happens is, if you have your brain, this is my little brain here and spinal cord, and you have little nerves going to your arm, let's say, right? Yes, that's right. You have a cartoon arm here, cartoon hand. So if you have an injury to the hand, that causes this signal to occur that goes through the nervous system up to the brain. And if this trauma, this injury, either does not heal appropriately or does not start to function appropriately, then these signals start to get more persistent into the brain, and then the brain starts getting more wired to feel the pain. In some people, this system actually helps them feel less pain. It's as if they're getting used to constantly causing irritation to an area. They start to kind of adapt to that. But in a lot of folks, it actually makes us more sensitive to pain. So the analogy that I use is that if you ever hit your elbow on a table and you hit your funny bone, well, that's actually some neuropathic pain. There's a nerve that travels right there. If you hit that, then that shock that goes up, that funny bone sensation, is an irritation to the nerve. So if you did that, that's uncomfortable, right? It makes you feel a little bit funny for a while. Now imagine if you did that over and over and over again. Some people would be like, all right, I'm doing this over and over again. It's not bothering me anymore. But a lot of people, if you're doing this over and over and over again, hitting your elbow on a table, pretty soon, anytime I got close to a table, I'd be like, hey, there's a table there, right? Your body would impulsively or reflexively react to the fact that we are getting near something that is causing trauma. And in some people, even though we've stopped hitting our elbow on the table, we'd still feel pain associated with that area. And that could be if there's damage that has occurred to the nerves, again, that neuropathic pain. That could be if damage has occurred to the elbow, that nociceptive pain. Or that could be when that nervous system has become sensitized and has become irritated, and that's that nervous system or other type of pain category that develops into chronic pain. So that's an important thing to consider, because if we understand that, then the concept of chronic pain becomes a lot more complicated. It becomes a lot more complicated because chronic pain in itself is its own condition, right? I broke my leg. Is that nociceptive pain? That's its condition. But then the pain separately, if it goes on for long enough, becomes its own issue. And we see that a lot with various different conditions, low back conditions, neck conditions. We see that with a lot of different situations. And then we end up having to try to manage the chronic pain itself. So if you've been suffering with chronic pain for any length of time, if you've seen your physicians with a complaint of chronic pain, then you may be very familiar with the types of treatments that are available for chronic pain. And obviously, a lot of times we try to figure out what is it that's causing the pain, right? What is it that was the original injury, nociceptive, neuropathic issue, and is that something that we can manage? Is that something that we can try to treat? But while we're doing that, or if we've tried to do that and we still continue to have pain, we end up going down the route of things like pain medications. And pain medications, for some people, are actually a very important part of the strategy or treatment of chronic pain. And in a lot of people, it's actually necessary to be on certain pain medications to decrease those chronic pain signals that are going on. However, in some people, those pain medications may actually add fuel to the fire. So the reason that I say that is because with chronic pain, with or without pain medications, with chronic pain, we could develop this level of what's called pain hypersensitivity. And what happens with this is that like I said, the nervous system gets screwy. And I'll describe this with an analogy that I've used before for Facebook Live, and I've used it in other talks. I stole it from a TED Talk myself, so I can't take full credit, but I did modify it for my own. And that is that the body is like a bank. And when the bank gets robbed, that's when you have an injury. That's when you have a nociceptive pain event. When the bank gets robbed, the bank owner is like, hey, I got to increase my security system, right? I got to increase my security system so I don't get robbed again. But the bank gets robbed again. We have another injury or a re-injury of something that's been previously injured, or we don't heal appropriately and we aggravate the area, right? So the bank gets robbed again. Well, what happens if the bank gets robbed again? Well, the bank owner says, all right, I'm going to increase the security system again, right? But then the bank gets robbed again. And this pattern continues. We get an injury, the bank gets robbed, the bank owner increases the security system. And this pattern continues to the point that the security system ends up being so sensitive that pretty soon a damn pigeon is walking past the bank and the alarm system goes off. Now, the pigeon might be pooping on the sidewalk. It might not be comfortable, but it's not necessarily robbing the bank, right? It's not causing damage. Whatever situation that you're in may not be causing damage to your tissue, to your leg, your arm, your body, etc., but your body reacts as if it is. So when the security system goes off in the bank, what happens? The police come, the fire department comes, the doors lock down, etc., 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 and the system reacts as if the bank is getting robbed. The system reacts as if your body is getting injured. And that's an important thing because that causes our muscles to tense up. That causes us to move away from activities that we should otherwise ordinarily be able to do. This causes us to walk abnormally, move in weird patterns. And these things actually add on additional nociceptive issues. Why? Because if your knee got injured and now your system is sensitive, so you don't walk properly because you don't want to aggravate the knee. Well, once you're starting to walk improperly, well, now you're going to start to aggravate your ankle, your foot, or your hip, or your low back. And when you start aggravating other areas, again, these are all circumstances where your bank is getting robbed. So the system continues to get more sensitive, and there's more layers and layers that are added on over across the board. Now, why do I mention this in context with pain medications for the management of pain? Well, because the pain medications, particularly for long-term use, actually make your bank security system more sensitive. So it's an important statement, because if you're on these pain medications for long term, not everybody, some people, they're able to live perfectly fine with these pain medications, but if you're on these long term, for a lot of people, it actually makes the sensitivity increase for your nervous system, and it makes it easier to have pain. That's part of the theory or mechanism behind why we develop tolerance for pain medications as well, and why we end up having to take more and more and more pain medications when we're in chronic pain. So it's a really important concept to consider, because that helps us manage what would we be doing when we have pain. It also makes us realize that, chronically on pain medications is not necessarily a good idea, but we oftentimes, when we have chronic pain, need to hit things from multiple perspectives. Like I said, the pain medications might be very reasonable as an option, as a part of the picture, but ultimately we have to hit things from other angles. So the opioid pain medications being one thing that could be used for treatment, but there are other medications that could be used as well. So you have your opioids, you have medications that specifically deal with nerves, things like gabapentin, Neurontin, Lyrica. Certain antidepressants may actually help with nerve-related pain. There are muscle relaxants that can help with the muscles to calm them down. And then there are other medications like anti-inflammatory medications called non-steroidal anti-inflammatory drugs. And for certain circumstances, a combination of these various different things can actually be beneficial. And sometimes some of these medications may actually help us prevent the necessity for others. So for example, gabapentin can oftentimes be used in conjunction with other medications to actually decrease our necessity for opioids. But in addition to these medications that we can take by mouth or sometimes topically, there are other things that we can use, such as supplements, such as our nutrition. There's anti-inflammatory nutrition that could play a big factor. If you've heard me talk before, I've talked about this a lot. But there's certain foods and supplements that actually can provide great benefit. Multicolored vegetables can really be helpful for decreasing inflammation. Avoiding things like processed sugars, which actually can feed inflammation, can really be beneficial. Increasing things like water and fiber, and getting the body hydrated, getting the system, the blood flowing appropriately, can actually be really, really beneficial in terms of improving pain and decreasing our necessity for medications. There are some newer kids on the block, things like CBD, which are showing promise in decreasing inflammation, and that's something that could be considered either topically or orally to help with chronic pain. And then there are non-medication or non-supplement things that could be used, devices that could be used to actually decrease pain, such as things like electrical stimulation devices. There's a thing called TENS, and there's a few different other varieties of electrical stimulation that work in different manners to actually trick the body into not feeling the pain. Actually, override the nervous system that's carrying the pain signals. And essentially, if you override those nerve signals, you're no longer feeling the pain, but you're feeling the electrical stimulation or vibration or various other signals that are created by these devices. There are wearable devices like TENS units. There are implantable devices like spinal cord stimulators that have had improvement in their technology over the last several years. And these are, kind of thin wire leads that are placed within the spinal canal, and they send a signal directly to the spinal cord, and by doing so, essentially trick the spinal cord into not feeling your pain. So there are, wearable and implantable devices that can neuromodulate or change the nerve signals of pain that we feel, and oftentimes these type of things in combination with appropriate medications can actually be really good for chronic pain. And then finally, there's another thing that we can, we think about what we can put into our body, or with these devices wear on our body, but there's things that we can do with our body, and the big thing, and it's something that I've talked about a lot before, is exercise. So there's a pain condition called fibromyalgia, which involves sensitivity to the muscles, where the muscles start feeling pain. It can oftentimes be associated with fatigue and other systemic conditions. But oftentimes, first of all, oftentimes fibromyalgia actually isn't fibromyalgia, it's specific injuries that are causing pain. But if we do truly have fibromyalgia or other pain conditions, the research shows that the best treatment for fibromyalgia is cardiovascular exercise. Getting that heart rate going, getting the muscles moving, getting the body moving correctly can oftentimes actually decrease our pain. Very important concept. And that's been shown with various different pain conditions, like low back pain, for example. There's a lot of research that shows that exercise should actually be our number one treatment for that. So, there's a lot of different things, a lot of different strategies that we can use for treating the chronic pain itself. There's one final thing that a lot of people actually neglect, but I think is actually a really, really important component of treating chronic pain, and that is actually more directly addressing that pain hypersensitivity that occurs, that system overload, that your bank's alarm system being, tightly wound up and very sensitive, that concept that your body feeling pain interprets that as damage. That is a component that can oftentimes be addressed really well with the appropriate talk therapy or psychology. Seeing a therapist to work through strategies in dealing with pain can actually be really, really beneficial at decreasing the sensitivity of the system. And the concept really comes down to is that not all pain equals damage. Right? If I hit my elbow and got that funny bone sensation, unless I really hit my elbow really hard, I'm not causing damage to my elbow, but it is painful. Right? I'm not causing damage to my elbow, but it is painful. And retraining the body, the mind, the nervous system, retraining that into recognizing that not all pain equals damage is a really, really important component of dealing with chronic pain. And that's something that, quite frankly, is oftentimes neglected. Our society as a whole has a stigma against seeing psychologists or talk therapists. But the reality is that that's something that's an integral part of dealing with any condition that has become chronic, and especially pain. So all in all, to summarize, chronic pain is its own thing. There's nociceptive pain, which is damage to tissue. There's neurogenic pain, which is damage or irritation to the nerves that carry pain signals. But then there's this kind of other world of chronic pain that has to do with our whole system being sensitized. And oftentimes when we have chronic pain, we need to address all pieces of the puzzle. If you have chronic pain, and especially if you have chronic pain in certain specific recurring areas, It's always really important to make sure we have an appropriate diagnosis to figure out if there is some sort of nociceptive or neurogenic pain that we can actually treat and manage with specific treatments. In addition to just treating the chronic pain, we should really make sure we're treating the nociceptive and neurogenic components. But then the treatment of chronic pain itself ends up being so multifactorial, as I've mentioned. So I hope this all made sense. We went over a lot of things. If you enjoyed this, then please feel free to comment. You can DM me. You can comment if you have any questions, or you can contact us at info@fxregencenter.com. If you enjoyed this talk, if it found it helpful at all, please feel free to share it to your friends, your family, your enemies, your whoever. Because I do think it's an important topic that needs to be addressed and discussed over and over and over again, because in any way, shape, or form, we're all going to be affected by pain at one point in our lives. And if we are affected by chronic pain, I think it's important to recognize that there's a lot of different options to help you. We're going to go on for the next few weeks, and we're going to have a few breaks over the course of the next few Fridays because of Thanksgiving and the holiday season and everything. But stay tuned. We'll keep you posted in terms of what topics we're going to be discussing on our Facebook and our Instagram pages at Regen Dr. Patel. If you have any questions or concerns, again, then feel free to contact us. And I wish you a very happy Friday, a happy weekend. Hope you all had a happy Veterans Day. God bless and have a good week. We will see you next week.